Hi, I'm Ira from Lavender Medicare. Today we're going to share with you more about spine degeneration, how to take care of it and how to prevent it from degenerating. We're inviting Dr.Chou Ning, a senior neurosurgeon from Singapore, to share more with us about spine degeneration. So let's come and meet him. A lot of people say, oh, I have back pain, I have numbness in my fingers or tingling sensation. Is that a sign of spine degeneration?
The way to look at spine is that spine composes of the cervical spine, the thoracic spine, and the lumbar spine. Now, looking at the whole spine, the thoracic spine doesn't move and is well protected by the ribs. So it rarely features in any of the major degenerative conditions that most of us suffer from. The mainstay of our degenerative spine comes from the cervical spine, whereby the cervical spine supports the head and is so flexible. And the other one will be in the lumbar spine, whereby it is more mobile and the lumbar spine supports the whole body weight. In the case of the cervical spine, the presentations are generally either pain, numbness, ability to walk, and also control of the bladder bowel functions. When the nerve is compressed, patients will complain of neck pain, and sometimes they also complain of numbness. A very useful question to ask is does the patient have difficulty picking up small objects like a pin or even managing the buttons on the clothes? Then there may be some problem with the nerves which is controlling our fingers. In the cervical spine with degeneration, sometimes the spinal cord is compressed. And when the spinal cord is compressed, then all the nerves downwards are also affected. Because the walking is a bit stiff, in order to stabilize themselves, they tend to take on a wider stance. That means the two legs are wider apart. Sometimes they will complain of discomfort under the feet, as if they are walking on a mattress. The ground doesn't feel so real to them, that the whole body weight from the waist up is supported by the lumbar spine, especially the L5, L4, L5, and these are the weight that's going to compress down on the sacrum. So when the degeneration occurs, if the nerve roots are compressed, if this is the L5 nerve root, then basically the pain will go down to the knee. Now on the other hand, if the S1 nerve root is compressed upon, then the pain will go down to the foot. So on the other hand, if there's a prolapsed disc, the disc that compresses backwards upon the spine, or when degeneration happens is that the spinal canal here is severely narrowed, then patient will complain of severe back pain. But a lot of times it remains asymptomatic until a defining moment whereby patient slips, falls, or does something to aggravate it, then the pain will come. Most treatment for degenerative spine per se are treated with analgesia and physiotherapy. Surgery to fix the spine is not the mainstay of treatment. And with time, 60 to 70% of the pain will go away. Unfortunately, at times whereby some patients suffer from intractable pain. Intractable pain means the pain that does not go away, pain that they'll tell you, doctor, I can't sit, I can't stand, I can't lie down, I cannot find a position whereby I obtain relief from the pain. And if the patient is 50 years old, you can't expect the patient to be in pain for the next 40 years. Surgery can be straightforward provided we identify the exact problem. If a nerve root is compressed, the pain is radiating down the legs. So we just got to free the nerve root, be doing a small foraminotomy, or if the cord is compressed with severe back pain, then we just need to relieve the pressure. Medication is primarily to stave off the symptoms. And a lot of times it does settle. Before
the pain is severe, is there any way that we can prevent it, like any exercises or supplements?
Calcium would help, vitamin D would help, exercise, and more important, keeping the spine supple and flexible goes a long way.
Is it a condition where it is inherited by our DNA?
In ankylosing spondylitis, there's a genetic abnormality. There's no medication to prevent it, but what we can do is that we can do physiotherapy to keep the spine supple as much as possible.
So is it possible to really fix the problem with surgery?
If we find that medication physiotherapy is not able to help and the patient is in severe pain, a lot of times when the patients get it done, when the pain is gone,
Quality of life is better.
yeah, quality of life is better, and they come back to your clinic with a glitter in the eye, and it's like a new lease of life. So this is what we would like to do for our patients.
So having an active lifestyle, exercise, eating calciums, vitamin D3, keeping your posture correct is helpful to prevent spinal degeneration in the future.
I absolutely agree. I absolutely agree.